On the 5th of January 2025, the District Health Office received information from the in-charge of Agoro Health Center 3 indicating that they had noted an increase in the number of people presenting with cough, diarrhea, vomiting, and severe weakness. But majority did not have cough. The majority had only diarrhea, vomiting, and severe weakness, which by history had lasted for less than 2 days. On that day, 4 people were already admitted at the health center, and the previous day, 2 had reported in OPD. On the 7th, the number increased. 6 people came to the facility with vomiting, severe diarrhea, and severe weakness. We prompted the district rapid response team to move to the facility. On the 8th, we went prepared with the rehydration kits and assorted medical supplies. We had also collected with us rapid test kits for cholera, aware that our neighboring country, South Sudan, is having an ongoing outbreak of cholera. Indeed, when we reached the facility, we found admitted on the ward were 11 patients, vomiting, having diarrhea, but they were in a fair state of hydration since they had already received some fluids. We collected stool samples from them, tested. 3 samples collected all turned positive for cholera, and 1 client had died that morning before arrival to the facility. We also took samples from the dead body. Then the rapid test, it also turned positive for cholera. So at operational level, we developed an impression that the situation was most likely cholera. We started now putting in place measures to handle these clients in line with the cholera management, and also seeing what to do within the facility in regards to infection prevention and control. We had a meeting that same day with the sub-county leadership, telling them what the situation was most likely about and what we should do in the community as far as prevention is concerned. So far, the district task force has had 2 meetings. The second one was yesterday in the facility. We gathered all environmental health staff, VHTs, and sub-county leaders. We line listed all the clients and their contacts, moved to their households, visited all the 6 parishes in Agoro, and identified a number of gaps at household level, and we are now addressing those gaps together with the community. Cumulatively, we have registered 48 patients, 1 death, 26 have already been discharged. So far, we have 22 admitted on the ward. Yes, the number is increasing. Yesterday, we admitted 11. Yesterday before, we had 19. Today, so far, we have had 6. But we are ready as the district health team, together with our partners standing with us in health, the UNSCR, IRC, CESV, WHO, UNICEF, and colleagues from the neighboring districts of Kitgum, Amoro, Gulu, and Lusiti as well. We believe that with concerted efforts, especially in enforcing infection prevention control measures in the community, hygiene and sanitation issues, we should be able to contain and interrupt the spread within the next 1 week. We have had support from the Regional Referral Hospital through the Public Health Emergency Center. We received assorted medical supplies last evening. Ministry of Health through CPH Health yesterday also delivered to the district more rapid test kits for cholera, and we have delivered samples for PCR test to CPHL last evening. We believe by tomorrow we will have known exactly what we are dealing with through confirmation by Ministry of Health, and accordingly Ministry of Health will make a statement. As of now, at operational level, we suspect we could be dealing with cholera basing on the clinical presentation and the rapid test which we have done. The final confirmation will come from Ministry of Health basing on the PCR test results for samples that we have submitted. People should not panic. Cholera is not like COVID. It is something simple to prevent. It is about hand washing with plenty of clean water and soap, eating hot food, and proper use of pit latrine in our homes. If we observe these measures, within few days, we should be able to interrupt the transmission. We highly suspect this infection came from South Sudan because we had 3 major events in the last 2 weeks, which brought together a big number of people from South Sudan mixing with the people of Agoro sub-county. On the 22nd, there was that market day where over 1,000 people had gathered, about 300 from South Sudan. On the 25th, they feasted together. On the first, they had the New Year festival together. So most likely all these events brought into the country cholera. But we believe that together with all stakeholders, Resident District Commissioner and his team, the district chairperson and his entire team, all the other stakeholders and the medical fraternity will contain this cholera outbreak. Thank you.
My name is Oyet Sisto Chen. I'm the LC5 of Lamwo. On the 5th of this month, the health center of Agoro started experiencing a strange disease whereby people with diarrhea and vomiting started coming to the hospital. Their number kept on increasing. Then on the 10th, that was when the DHO and other team from the district went and they did a rapid test, and they did confirm that the strange disease is the cholera. So as we talk right now, there is confirmed cases of cholera. On the 10th, we had the cholera task force in the health center 3, and the cumulative cases that have been confirmed, they are 35 people. But yesterday, more cases have increased, and so far there is one death. A woman of 42 years old has died, and the sickness is coming from all the parishes of Agoro sub-county. And this has started after an auction that took place in Agoro. Agoro sub-county is in a border point between South Sudan and Uganda. And this came after the auction. We are suspecting that the sickness came as a result of the auction. The people who came from South Sudan could have come with a case, because a week before, there is a lady who came from Juba, came to the refugee settlement and developed the case of cholera. But the one in the settlement has been managed. The one of Agoro, the intensity is high, and we are calling upon the central government. We have already communicated to the Ministry of Health, and we have communicated to Gulu, the regional office, and we are also calling upon the partners, because right now we have challenges of the cholera bed, we have challenges of the staff. We have gathered the staff who are in other health facilities within Lamwo, and we took them to Agoro. But still, the number keep on growing, and those other facilities that we've gathered the staff from now, they are left without the staff. So we are calling upon the development partners, such as the UNICEF, the World Health Organization, and other agencies who are working with us in the settlement, to really join on so that we can fight this emergency. So far, we have been telling our people that to control this sickness, they need to wash their hands continuously. After the latrine, you need to wash your hand. After eating, before eating, you need to wash your hand. And we are also emphasizing that they should use toilet, because in Agoro there is a river called Okora. And that river point, you'll find that people bathe there. Some people also defecate near, and the same river also people drink from. So we have been sensitizing. Up to now, the sensitization is ongoing, so that we can curb this. And the team of surveillance, they are on the ground. They are following cases of the suspected cases where the people have gone to the community. We told them to trace all those cases and bring them to the health facilities. But for now, we are lacking the supplies. The supplies are not enough. We need a cholera bed, and we need at least extra 10. We are happy that so far UNHCR has come in. They have given us some other items, but those items are not yet enough. We need to put our head together so that we can control this outbreak.
As the chair of Public Health Emergency Operation Center, Acholi Sub-Region, as we speak now, we have 48 cases of cholera that we have in Agoro Sub-County. Now, what I want to say is that when the district informed us at the region, as the chair, I immediately reached out to the director, Gulu Regional Referral Hospital, who in turn, we escalated the situation or the message that reached the ministry. Immediately, the ministry sent us 200 test kits to support in the process of testing those who are having signs of cholera, that is vomiting and diarrhea. Now, when that happened, together we talked to other development partners like Uganda Health Activity to support. And as I speak now, the team from the ministry, that is from the regional referral of Gulu, are all in Agoro Sub-County, working together with Lamwo local government. And because of that, we have really managed to, as much as the cases are 48, but we only had one death. And up to now, as we are speaking, discharge is really going on. You know, we have in total 48 cases, but then more than 10 have already gone home. You know, and we believe even today more will go home. But we are carrying on with a lot of aspect of community engagements, because cholera is a lifestyle disease or sickness, and which can be a very serious emergency if not managed well. And therefore, as the operation center handling emergencies, we are really on top. I want to call upon the region or Lamwo district to remain calm. The situation is really under control. Tracing of contacts is all ongoing on very well. Just today, one of the teacher who got in contact with with a sick person in Agoro, we have taken the person from Lamwo back to from Padibe back to Agoro Sub-County. Now that tells you how vigilant the operation center is trying to work around the clock to ensure that all those that we have issues of contacts are all got tested to ensure that we curb down the spread of cholera in Agoro Sub-County, Lamwo. But of course, we are always very cognizant. Lamwo is at the border, and therefore, it's our key interest to ensure that we safeguard, as the operation center, what is taking place. Because if not managed very well, it has the capacity to spread, and we are really on top of it.